JAMA Network.
The patient viewing healthcare in 2013 must envision a decade or more of uncertainty.
Dr. Hamilton Moses from the Alarian Institute and colleagues analyzed U.S. healthcare trends over the last 30 years. The results appear as a special communication in a theme issue addressing critical issues in U.S. healthcare in JAMA, Journal of the American Medical Association.
All of our information comes from publicly available sources. That's a very important point. This is freely available information, although the challenge was to compile it in a way that was interpretable.
Overall healthcare spending dropped from its peak of about 8% in 1970 to its current rate of 3%. Care for people with chronic illness is the main reason for the increase in spending.
The overall amount of spending that occurs with people who have chronic illness is about 85% of the total.
The common perception is that the elderly spend the most on chronic problems. Not true, says Dr. Moses. Those under 65 are spending the most. The U.S. is also falling behind other developed countries in life expectancy, even though we are living 30 years longer than we were in 1900.
We are inconsistent within the U.S. itself. Depending on where you live, your life expectancy may vary by as much as 3 or 4 years compared to your neighbors.
There is also a triangle of conflicting forces involving the patient, clinicians, and those who pay for care. For the patient,
the main goal is to get the best advice, the most expert care, to have a choice in that care, to have as little out-of-pocket spending as possible on premiums and care directly.
And for the clinicians,
traditionally doctors have had an alliance with the patient. The real risk that we see is that the physician will be pulled to the social policy side of the triangle at the expense of the patient.
Those who pay for care want what's effective for everyone, the most access to care, and to control costs.
In our view, these tensions are the chief issue on the table for the next decade.
Catherine Dolf, the JAMA Report.